Auzubillahi minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. Nahmaduhu wa nusalli ala rasulihil kareem. Students, almost we have covered all the topics. I think this is the last topic which we are going to discuss, that is aminoglycosides. But in the previous lecture, one question was raised by Josefa about the roxithromycin. I am going to send you the slide for that, and inshallah we are going to discuss it in the upcoming lecture. These aminoglycosides, they are derived from the streptomyces, and a number of compounds are included in this class named as streptomycin, gentamicin, neomycin, kanamycin, tobramycin, amikacin, a semi-synthetic derivative. But according to our syllabus, just we are going to discuss the two specific compounds. One is streptomycin and the other one is kanamycin. Here we are going to discuss the general characteristics of the aminoglycosides. Aminoglycosides may be termed as a protein inhibitor, as it is going to inhibit the synthesis of the protein. Also named aminoglycoside due to the presence of amino sugar. All of them are active against the gram-negative, gram-positive, and specifically against tuberculosis. While if we are considering the general role of these compounds active against gram-negative aerobic bacilli, while they are also effective against gram-positive cocci, but mind it, they are not active against gram-positive bacilli and anaerobes. They are not positive against gram-positive bacilli and anaerobes. All of these compounds have got one amino hexose sugars or a pentose sugar, maybe lacking the amino group, as in the case of streptomycin, while they have got one highly substituted diamino cyclohexane. They consist of amino sugars linked as glycosides or linked glycosidically. All of these compounds are used primarily in infections caused by gram-negative bacteria, as they are poorly absorbed if given orally. The systemic use is also restricted due to auto and nephrotoxicity. All of these compounds also have got another side effect or undesirable effect, that is, resistance is developed in a number of compounds. At least 9 different aminoglycoside inactivating enzymes are identified, which differ from each other. They have got different functional groups as a target. All of these compounds have got another undesirable effect. A number of organisms develop resistance against these drugs or compounds. This resistance is developed by the synthesis of a number of compounds synthesized by the resistant strains. They synthesize the enzymes which are going to acetylate or phosphorylate or adenylate the key functional groups that are amino or hydroxyl groups of these compounds. Another specific point for this resistance development is that this characteristic is going to be transferred to the next generation of the organisms. They are going to be transferred. If you consider the mechanism of action, as in the beginning I have told you that they are termed as protein inhibitors. They are going to inhibit the synthesis of the protein. They inhibit the initiation of protein synthesis. They interfere with the translation of the genetic message. They bind to the 30S ribosomal subunit to form a complex that is unable to initiate proper amino acid polymerization. The binding of streptomycin and other compounds to ribosomes also causes misreading of the genetic code. This is the general indications or clinical uses of all of these aminoglycosides. They are active against gram-negative bacillary infection. They can be used in bacterial endocarditis, in the case of pneumonias, tuberculosis, particularly in the case of tuberculosis meningitis as compared to the pulmonary tuberculosis. They are also used in the cases of tularemia, plague, while due to its less solubility, they are generally used in the form of parenteral preparations, while we have got the topical preparations from neomycin and pharm714, generally used in the cases of conjunctiva or infections of external air. As they are absorbed very slowly, they may be used to sterilize the bowel of patients who are going to have immunosuppressive therapy before surgery and in hepatic coma. If we are going to consider the SAR of these compounds, here we have got 3 rings: ring 1, ring 2 and ring 3. In the ring 1, the 2' and 6' amino groups are especially important. Exchanging of one of them in the kanamycin B with hydroxyl group decreases the activity. Exchanging one of the amino group will decrease the activity. As we can see that this is the structure of kanamycin B, but in the case of kanamycin A, at 6th position, amino group, if replaced by OH, methylation of C6- or 6-NH2 does not change the antibacterial activity, but instead of that, they increases the resistance against aminoglycoside inactivating enzymes. Removing the 3 hydroxyl groups or 4 hydroxyl groups in kanamycin D in kanamycin does not decrease the antibacterial activity, but increases the resistance against aminoglycosides. We have got a semi-synthetic derivatives, that is amikacin from the kanamycin A. According to few modifications can be possible. One amino group of kanamycin A can be acylated, resulting in amikacin, which retains the antibacterial properties while have got more resistance against the bacterial inactivating enzymes. In ring 3, commonly we have not got any compound in which the modification is carried out. Only the 2' deoxygentamycins are available which have got less active or less activity than their 2-hydroxyl counterparts. Streptomycin was the first aminoglycoside which was used as antibiotic in this chemotherapy. The compound was discovered in 1944 by Waxman and their collaborators. It is derived from Streptomyces griseus, one of the oldest compound which is used against tuberculosis, mainly in the cases of tuberculosis meningitis and also in the cases of pulmonary tuberculosis. Streptomycin does not have got 2,2-deoxystreptamine. Instead of that, it has got the streptidine. It consists of 3 moieties which are linked glycosidically. One is N-methyl glucosamine. Another one is streptose, and the third one is streptidine. The correction in the spelling is streptidine. Instead of Y we have got I. In the same way, here we have got a correction, streptidine, T-I-D-I-N-E. Instead of O, I, streptidine. SAR of streptomycin. SAR is deeply studied. Modification of streptose is extensively studied. Reduction of aldehyde to alcohol results in the compound which have got the similar activity as compared to streptomycin, but it has got more toxic effect, that is ototoxicity is more and result in the deafness. One of the example is dihydrostreptomycin. Oxidation of aldehyde group to oxime or phenyl hydrazone or semicarbazone results in inactive compounds, while the oxidation of CH3 in streptose to a methylene hydroxy give an active compound, but it is not it has not got any advantage over streptomycin. Modification of aminomethyl group in the glucosamine by demethylation or replacement by larger alkyl groups reduces the activity. In N-methyl L-glucosamine, NCH3 group is very essential for the activity. Guanidino groups in streptidine ring are essential. Replacement of guanidine groups reduces the antibacterial activity. In N-methyl-L-glucosamine, the N should be secondary amine. We have already discussed the general mode of action of all of these compounds. All of these compounds have got the similar mode of action. Streptomycin is bactericidal in action. It inhibits protein synthesis by combining irreversibly with the 30S subunit of the 70S ribosomes. It binds with a protein involved in the initiation of protein synthesis. Streptomycin prevents the initiation of protein synthesis by blocking the binding of initiator and formyl methionine tRNA to the ribosome. It prevents the normal dissociation of 70S ribosomes into their 50S and 30S subunits. Overall, streptomycin involves the distorting the ribosome so that transition from initiation complex to chain elongation ribosome is blocked. Since these compounds are not absorbed from the gut, they are administered intravenously or intramuscularly, while few are used in topical preparations. As we have already indicated, in the case of wounds or in conjunctiva or in external ear infections. Oral administrations can be used for GIT decontamination as it is not going to be absorbed. If we consider the clinical uses, streptomycin is one of the compounds which, when discovered, it was said that we have got an effective tool against the tuberculosis. It is used in the cases of active tuberculosis, but it is used in combination with other compounds such as isoniazid, rifampicin, and pyrazinamide. It may be useful in the cases where resistance to other drugs is identified. The compound is more effective in the cases of tuberculosis, meningitis, also used in the cases of pulmonary tuberculosis. It is also used in the treatment of plague, dysentery, urinary tract infection, respiratory tract infection, peritonitis, and meningitis. Streptomycin is contraindicated during pregnancy. It is also contraindicated because it have got the interaction with other drugs such as furosemide, minocycline. Also contraindicated with the nephrotoxic drugs such as vancomycin or cisplatin in elderly patients where the kidney function is altered. Also should be used cautiously with the muscle relaxants. The main toxicity is the ototoxicity. The compound is going to damage the 8th cranial nerve. It damages the vestibular system, resulting in temporary or permanent loss of hearing, vertigo, nausea, loss of equilibrium or balance. The compound is also nephrotoxic. Kanamycin is a mixture of three main components: kanamycin A, B, and C. But generally, the kanamycin which is used is kanamycin A. It is isolated from the streptomyces kanamyciticus, and most commonly used form is its sulfate or kanamycin sulfate. Kanamycin A is the major component in kanamycin. It is used to treat severe bacterial infections and tuberculosis. The compound can be used orally or parenterally. IV or IM route can be selected. The compound is not an antiviral compound, or it has not any effect on viral infections. The effect of these components do not appear to be widely studied as individual compounds when used against prokaryotic and eukaryotic cells. The difference in different components, that is kanamycin A, kanamycin B, and kanamycin C, is only at the site or which is indicated by R or R1, R dash. In kanamycin A, R is NH2, R is NH2, and R dash is OH. R dash is OH. In kanamycin B, the R is NH2, while R dash is also NH2. In kanamycin C, the R is OH, while the R dash is NH2. Kanamycin also have got the same mechanism of action. It inhibits the synthesis of protein. It binds with the 30S subunit of the bacterial ribosome, results in incorrect binding with the mRNA, and eventually leads to a misreading which causes the wrong amino acid to be placed into the peptide chain. This leads to non-functional peptide chains. The compound is indicated for short-term treatment of bacterial infections caused by one or more of the pathogens such as E. coli, Proteus, Enterobacter aerogenes, Klebsiella pneumoniae, Acinetobacter species, or Serrata marcinis. While it is also indicated somewhere that when the causative organism is unknown, kanamycin injection is used in combination with penicillin or cephalosporin for initial treatment or to initiate the treatment before obtaining the results of susceptibility. The compound also have got the same toxicity. Compound is ototoxic and nephrotoxic. That's why the use is restricted or limited. Amikacin is the derivative of kanamycin A. It is a semi-synthetic derivative. In this, acylation was carried out, and due to this we have got a compound which have got more resistance, or more resistance is developed, or resistance is less. It has a wide spectrum of the activity, may be used as alternate to gentamicin, but have got more side effect, that is loss of hearing. Here we are going to conclude this topic, and inshallah we are going to discuss it in the upcoming lecture. Inshallah. Thank you very much. Allah Hafiz.